Welcome to the 1000 MCQ series of Pharmacist, Analyst and Drug Inspector Examination. This is our exclusive course for Analyst Grade 3 exam. So let's get ready to crack this exam. Starting off with the first question of the day. In selective inventory control, it is beneficial to combine. Is it SOS and XYZ method, HML and FSN method, ABC and HML method, or SDE and XYZ method? Yes, in the question they have asked selective inventory control. Right, now in ABC analysis and HML analysis, what we are doing in ABC, we are dividing the inventory based upon the annual usage value, right? Which means A means high value items, B means medium value item, C means low value item, right? Now coming to HML analysis, here we are categorizing based upon what? Based upon the criticality or the importance to production process, such as high criticality item, M means medium criticality item, and L means low criticality item. So if we combine ABC analysis along with HML analysis, we can get selective inventory control, right? We can get better control. So what will the answer for this question? It will be ABC and HML methods of analysis. Coming to the next question, Ciprofloxacin is A. Is it quinolone, quinilion drug, isoquinoline, quiniquidin drug? Yes, ciprofloxacin is a second generation fluoroquinolone antibiotics, right? These are derived from quinoline. Now this is the structure of quinoline, and this, as you can see, is the structure of ciprofloxacin. So ciprofloxacin is a quinoline derivative. Now coming to the third question, sulfur drugs are titrated by which type of titration? Is it diaterization titration, redox titration, non-aqueous titration, or acid-base titration? See, in sulfur drugs, as we know, we are using diaterization titration. So what happens here? A primary aromatic amine group will be there, which is present in the sulfur drug. So this will react with what? HNO2, that is the nitrous acid, and it will form the diazonium salt, right? Now here there will be excess of nitrous acid, right? So this will be back titrated by using a reducing agent. Some of the, like a standard reducing agent is potassium iodide. So this potassium iodide will be titrated with the excess nitric oxide, and we will be using indicators such as iodine. Iodine indications will be used. So this is how we can quantify the amount of sulfur drug which is present in the sample that is given to us, right? So the titration method for sulfur drugs are normally diaterization reactions are used. Coming to the next question, which of the following is not a subtype of oilments? Oleogenous, absorption, water washable, or plasters? Here it is very clear. Plasters. What are plasters? Plasters are solid dosage form. Now this will adhere to the skin and it can release medication over a period of time. But what are oilments? Oilments are semi-solid dosage form. So these are mainly topically applied or applied to the mucous membranes. Right. Coming to other options is oleogenous or adsorption or water soluble. All these are type of oilment bases. But plasters means it is a solid dosage form. Will the question for this answer? It is not a subtype of ointment, it is plasters. Coming to the next question, effect of fibrates on blood lipids are mediated by? Is it mediated by inhibiting both the synthesis and esterization of fatty acid, or their interaction with peroxisome proliferated activated receptors, or reducing the conversion of HMG CoA to malonic cation, or sequestering the bile acids? Yes, fibrates exert their lipid lowering effect by primarily interacting with peroxisome proliferated activated receptor, especially PPAR alpha, right? Especially PPAR alpha. So what it does, it increases the lipoprotein lipase activity. This lipoprotein lipase is that particular enzyme, right? Now, coming to the VLDL production, VLDL production is reduced. Coming to HDL production production is increased. Now coming to the triglyceride, the hepatic synthesis of triglycerides are reduced. So what will the answer for this question? Fibrates interact with the PPARS, especially the alpha. Now, so option B will be the answer for this question. Coming to the next question, a cardioselective beta blocker with vasodilating property is. Let's see the options. Pindolol, atenolol, bisoprolol or nebivolol. Nebivolol is one of the unique beta blocker that have both this cardioselective beta blocking activity as well as vasodilating activity. Now, how this acts? This will bind to the beta receptor. Which receptor? Beta 1 receptor, which is present in the heart. As a result of this, what will happen? There will be reduction in heart rate and blood pressure. Now, this is one action. Another, additionally, along with this, they have vasodilating property. Now, this is due to the ability to release nitric oxide. We know nitric oxide will relax the blood vessels. So, it has vasodilation activity. So, this is a particular drug, that is nebivolol is the drug which has dual action. Right. So, here in this question, the cardioselective beta blocker with vasodilating property is nebivolol. Come to the next question. A mass spectrum is obtained by plotting in MS or mass spectrometry. What we get an outcome is a mass spectrum. So it contains what and all? Molecular weight versus peak height, concentration versus peak height, concentration versus degree of deflection of ions or abundance of ion versus their M/E ratio. Yes, in mass spectrum, as you can see here, in mass spectrum there is relative abundance against M/Z value or M/E value. M/Z or M/E is the charge, mass to charge ratio. So here, as you can see, the correct option will be option D, that is abundance of ion versus their M/E ratio. Aldehyde can be distinguished from other CO containing compounds by IR, that is infrared, due to, is it due to low frequency of absorption of aldehydes, the alkyl or group that is attached to the C double bond O, the double bond that is present, C double bond O double bond, or the doublet at the CH stretching region. Yes, as we know, the most specificity in IR is that doublet at that CH stretching region. So aldehyde have characteristic doublet in IR in which area? In around 2720 to 2820. Right. So here is the characteristic CH stretching that is taking place. So this doublet is due to the CH stretching vibration of the aldehyde hydrogen. Now this unique feature helps to distinguish aldehyde from other type of carbonyl compounds such as ketones. So this is very important. Doublet in the CH stretching region is very important. So what will be the answer for this question? It will be option D. Coming to the next question. When ammonium chloride is gradually and slowly incorporated into an emulsion stabilized with ammonium oxalate, what will happen? Now, emulsion will not change, or it will invert from water in oil to oil in water type, or it will invert from oil in water to water in oil type, or there will be no impact on the physical stability of that emulsion. Yes, here we are adding ammonium chloride gradually into an emulsion which was stabilized by ammonium oleate. So here we should know the properties of these. See, ammonium oleate is an ionic surfactant. So which type of emulsion does it stabilize? It stabilizes oil in water emulsion, which means initially it was oil in water emulsion. Now what are we adding? We are adding ammonium chloride. What is ammonium chloride? It is an electrolyte. So what it will do? It will reduce the interfacial tension between the oil phase and the water phase. as we are adding this ammonium chloride gradually, as the concentration increases, there will be phase inversion. Phase inversion means from oil and water type of initial emulsion, it will convert into water in oil type. So there will be inversion. So here, which option will be the most appropriate? From oil in water to water in oil type. So this is how it will invert. Choose the correct pair of the neurodegenerative disorders from those given below. Now let's see. Is it Parkinson's disease and Alzheimer's disease, schizophrenia and mania, Alzheimer's disease and schizophrenia, or Parkinson's disease and autism? So we have to choose which is the neurodegenerative disorder among this. So it is very clear which is the neurodegenerative disease. Parkinson and Alzheimer's disease. The neurodegenerative diseases are the diseases which lead to the progressive degradation or degeneration of the nerve cells present in the brain. So in Parkinson, as we know, these are affecting the movement, there are tremors, stiffness, difficulty in balance is all there. So this is also a neurodegenerative diseases where degeneration of the neurons are taking place. In Alzheimer's also, as a result of this degeneration, there is memory loss, cognitive function is affected, and various confusions are there, walking difficulties and problem solving ability. All these cognitive problems are coming in Alzheimer's. Coming to schizophrenia and mania, these are mainly what is a mental health disorder. They are not actually neurodegenerative diseases. Right. Coming to autism, autism is not neurodegenerative, it is neurodevelopmental disorder. So the most appropriate answer for this question will be Parkinson's disease and Alzheimer's disease. This is an exclusive course for ANALYST Grade 3 exam. So let's get ready to crack this exam. Hope you enjoyed the video. Thank you so much.